I just want to maybe ask Vernon, how much do you need? How much iron in milligrams or grams, or how does that picture look?
Right. So normally we absorb iron, or a very limited amount of iron, from our diet. The body also needs to protect itself from an overload of iron, which we'll probably talk about later if there's time. But it's typically 1 to 2 milligrams of iron per day that comes from your diet. And normally your diet contains 10 to 20 milligrams of iron per day. And you absorb about 10% of that. Now, there's a big difference between different types of things that you ingest. For instance, your better sources of iron would be heme iron, which comes from red meat, so beef, pork, poultry, all of that, especially organ meats like liver, very, very good source of iron. But iron from vegetables, and we all have heard about Popeye and spinach, is actually very poorly absorbed. So if you go and Google spinach and iron content, you'll see, it looks very good. But you need to eat calculated between 2.5 and 4.5 kilograms of spinach every single day just to meet your daily needs.
That's like a...
Yeah, it's a big bucket. I've not met many people that can do that. And then the other thing is also when we take iron supplements, you look at the box and you say, how much iron is in here? Just listen to this podcast. They say I need about 1 to 2 milligrams a day. And then you say, 300 milligrams per tablet. What's going on? But that 300 milligram is actually not the iron. That's everything in the tablet. There's lots of other stuff to keep that tablet together. And then you need to look at the elemental iron, which is, let's say for iron sulfate, ferrous sulfate, which is commonly used, 60 milligrams. That's still not the answer. How much of the 60 milligrams will be absorbed on a daily basis? 2.4.
Wow.
So people often, I've heard people say, well, if I take one of these tablets, I should be fine for a month. It's not how it works. And every type of iron tablet is different. And one needs to look at the package insert, see what the elemental iron is. You need to know and this is where you actually need your doctor's advice to help you get the right dose and the right amount and know how to take it. That's also changed quite a lot.
Yeah, I think that's probably where we can maybe it's a long discussion, but sure. I think we'll point our colleagues to your YouTube channel to maybe just see, because it takes months to actually, even if you do an intravenous infusion, more than a month to really get the value out of iron.
Yes.
So it's quite an educational process. So I think our colleagues that are listening to this should actually dig deeper if they think their patients are, or I can tell them they will have patients that are iron deficient,
sure.
how to actually treat them. So
yes.
That's it is quite a difficult thing, and you need to understand which iron you can take every day.
Exactly.
So I think
right.
that's quite important.
But maybe a few fun facts about the diet, if you want to, or let's say how your diet can affect your iron absorption, especially if you're on iron supplements. Many people are. So I think it's important to know that there are many things in your diet that can block iron absorption. So you don't...
It's like the tea and toast diet of the old people.
Yeah, exactly. So take the tea and toast. So the tea contains tannins, coffee contains polyphenols. Your cereals and your bread contain phytates. Eggs contain phosphatin. Calcium will compete with iron for absorption. So milk will also be a problem. So you've got all these things competing with iron or blocking iron or binding the iron, and it just goes right through. And there it's very important to look at the specific iron supplement you're taking, because some of them you have to take on an empty stomach, whereas others have been designed to take with all these foods without a problem. If you take a bit of orange juice, for instance, that will help your absorption of some irons. It will not make a big difference for others. So I always say you don't have to stop drinking tea and coffee. Just keep it for tea time. Keep it away from your iron, a few hours away. Don't drink it at the same time, because you're going to have problems. Except for rooibos tea.
Okay.
Rooibos tea, no effect. There's actually studies done at Stellenbosch University many years ago that showed, I don't know if you remember Prof. Hesseling and Prof. Klopper. They did it together in the 70s, and they showed that there's a big suppression by normal English tea, no effect by rooibos tea. So
That's good to know for our South Africans.
So if you think about taking iron, you really want an empty tummy if you can, and no medications.
I think ferrous sulfate is the ferrous ions generally can't be taken with food. There are some that can be, but there are a number of new ones, they are often more expensive, that can be taken with food. And yes, the drugs, the medications. So antacids, especially proton pump inhibitors and the old antacids that we used to use, the H2 antagonists as well. I don't think they use that much anymore, but the PPIs, very frequently used, overused in my opinion. They can directly block both the extraction of iron from the food and the absorption.
So for our listeners that are not medical, so that means if you've got any heartburn and you're on heartburn tablets, that's normally the PPIs, and they will block iron absorption. So definitely.
So if you are iron deficient, and that's now the issue, you might be taking one of those for a peptic ulcer, for a stomach ulcer, and
which cause the
iron deficiency. So I mean, it's one of the many causes of iron deficiency. I think the important thing is to not take the iron at the same time. Either take it 2 hours before or 4 hours after.